Alright, the first thing you want to do is take your frog and get your anterior, posterior, dorsal, ventral sides. Once you have it with ventral side up, you then begin to take some dissecting pins, lay down the arms, and stretch them out like so. Some of these arms, you really have to push those pins in order for them to stay. Same thing with the legs, trying to go between the toes. There you go. Now, there's really only about 3 cuts. 1, 2, 3. And then it flaps open, you see all the internal organs. And now's a good time to check your scalpel to make sure that it is a sharp blade. If it isn't sharp, you have to go right back on through and make your cuts again. And then the chest cut needs to be in the chest, not way up here, but right here. Now if you see this, not quite done. We get past the skin, past the muscle. Go back in and cut. Be careful not to go too deep because you don't want to cut the organs. So you have one flap open, take a pin, stick it through, then work the next side. And at some points, using scissors, just fine. Now that we have this open, we can go ahead and identify the internal organs. Using the diagrams provided in the lab, with the labs. Once you're done identifying all internal organs, be sure to move them around, look underneath, and try to determine the sex of your frog, then you may clean up, throw the frog in the trash can, clean up the entire tray, dry it off, restack it,